Hello, everybody. I'm Dr. Shabnam Daskar, specialist in functional medicine. I am right now in Calgary, in Canada, and I have a wonderful guest here today, Dr. Debojyoti Dhar, who is the co-founder of a company called Leucine Rich Bio from India. And I will let Debojyoti introduce himself, but what we are going to talk about today is one of the factors that impact the gut microbiome. So we'll go a little bit into what is the gut microbiome and just discuss one of the factors, which is medications. So Debojyoti, please will you introduce yourself?
Sure. Thank you, Dr. Kar, for the kind introduction. My name is Dr. Debojyoti, and I'm basically a PhD in molecular biology from Indian Institute of Science. And I've done my postdoctoral studies in UMass Medical School in US. I'm the co-founder of a company called Leucine Rich Bio, which is South Asia's first microbiome company. And we have developed South Asia's first gut microbiome test called Workspeaks, which has already been commercialized, and a lot of clientele from across the world have been using this test. Basically, we look at the microbiota profile of an individual using the stool as the sample. And we look at all microorganisms, bacteria, viruses, fungi, bacteriophages, and so on and so forth. And what we do with all the information is that based on the microbiota profile, we provide a report which gives information on possible or susceptible diseases which the individual might have, again based on the microflora. And then we provide personalized nutritional recommendation, again based on the microflora. And we also have a very interesting a marker which we call as rich index, or GMI, which provides information about the intestinal health with respect to the microbiota. And all these things are, we have filed patents for many of these things. So that's what we do. And we hope that microbiota, deserves its, the gut microbiome space deserves its due. Over to you.
Oh, yeah, absolutely right. And we used to think about the stool and stuff like that is just excretion and they don't have any significance, but it turns out that we are so wrong. Anyway, I'm going to start with sharing a PowerPoint.
Yeah.
So that is about both of us. Okay, so first and foremost, what is the human microbiome? As you can see on the slide, the human microbiome is a collection of all the microorganisms living in association with the human body. These communities consist of bacteria, viruses, yeast, helminths, a whole lot of organisms. And the other interesting thing is it's not just the gut where these microbes are present. They are present in even places where, as I'm a former OBGY, we used to always think the uterus is absolutely sterile and babies don't have any microbes at all, but it turns out that, we have found out a whole lot more. So where are all the different areas where you have, the microbiome exists? Some of the interesting areas, okay, gut is something we have been talking about. The other big area is the oral microbiome. So the microbiome in the mouth has a huge impact on long-term chronic disease like heart disease, cardiovascular disease. And from my world of autoimmunity, rheumatoid arthritis and oral microbiome, there's a very big connection. And I'm sure in time to come, we'll find even more information, interesting information about that.
Yes.
Your eyes have a microbiome too. But rather than focus on all the different microbiomes, the point is everywhere there is. So even on the skin, the interesting thing is these microbes are not just lying around doing nothing. They impact your health. And as Debojyoti said, we are giving a whole lot more respect to the microbiome now than ever before. So Debojyoti, I'll let you explain what is the gut microbiome and what happened with the human microbiome study. And so these are the two things that I'd like you to talk about.
Right. Yeah. So as you rightly pointed out, Dr. Kar, that we are basically more bacteria than human. There are multiple reports which suggest that per square inch of our skin has more bacteria than human cells. Well, the ratio of bacteria to humans, they vary. I mean, there are multiple ratio, but normally people say it is 1:10. So, and that's just bacteria. I mean, there are so many other, different classes of microorganisms that we can actually talk about. So gut basically has the maximum number of the microorganisms present in any organ in humans. As Dr. Kerr was mentioning, even the skin, the vagina, the oral cavity, everything has microbiota, present. Even your nose, everywhere we have microorganisms, and most of these microorganisms are what we call as commensals. Commensals are basically organisms which uh, 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 which do not harm the host, and in turn get some benefit out of the host. But many of these commensals can turn into pathobionts, or organisms which can harm the host. So there's a very 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 fine balance that these microorganisms play when it comes to taking care of the host and themselves. So it's a very evolutionarily interesting concept. When humans started walking on this planet, maybe the microorganisms by that time had already made their body their home, and that's how things started to come in this whole space. Talking about the gut microbiome, so the gut basically has trillions of microorganisms. It's the organ which has the maximum microorganisms in the body, as I mentioned earlier, and depending on which area of the intestine you are looking, uh, mostly the large intestine has the maximum microorganisms as compared to the smaller intestine. And then there are organisms which are obligate anaerobes in the large intestine. That means these organisms cannot function in presence of oxygen, so they need a non-oxygen containing space. But all these organisms play a definitive role uh, in the gut, starting from synthesis of vitamins to metabolism of food, and something that we are going to discuss, xenobiotics metabolism. So xenobiotics basically are substances which are not present inside the body; they are foreign to the body. So those kind of metabolism also happens because of the presence of gut microbiota, and of course, they provide what we call as uh, you know uh, they help in the barrier integrity also, because if the good organisms are present in high numbers, they probably will help take care of the pathobionts, which every time we are exposed to. So in short, gut microbiota plays a very important role. And as we also know that the intestine is the hotbed of all the immune system in the body. So if you look at it in terms of the physiology or evolution, uh, it makes sense, because your intestine is exposed to a lot of stuff that you ingest, and therefore it is very important that the immune cells are primed to those pathogens. So gut microbiota therefore plays a very important role, and starting from metabolism to immunity.
Thank you,
Yes.
Vipin. So the interesting thing is all these gut microbes also have genetic material, and
Right.
their genetic material interacts with our genetic material. So that is truly fascinating. I mean, it's a lot of people think that their genes decide their destiny, but the fact is genes do not decide your destiny. It is what you do with everything else. So that is a different conversation going into epigenetics. But the fact is, two important things that I want to highlight. Number one is your gut microbiome can change. So this change can happen for the better, it can happen for the worse. And there are ways in which you can change. So your genes will not decide your destiny. And the gut microbes have their own genetic information, which also interacts with our human beings' genetic information. Now, what are the different factors that influence the gut microbiome? On one side, I have factors that you cannot completely control. And on the other side, I have factors that you can control to a great extent. Now, what I want to highlight is the factors that we can control are actually more than the ones that we can't control. So birth mode, I'm not talking about birth mode here today. That's for another video. Whether a baby is born vaginally or by C-section can also decide what type of gut microbes they have. And some of that has also had impact on long-term disease, particularly childhood asthma, allergy. Allergy, I know, is not a big problem in India, but in countries like Canada, food allergy is a very big problem in the pediatric population. So that's for another time. Now, geography. So if someone lives in India versus someone living in a Western country or, in some other place, that also has a huge impact on what your gut microbiome is like. Genes, of course. Age, in our last video on gut and COVID-19, Devajyoti had talked about the lack of diversity in the gut microbiome of older people. So age has a huge impact too. And when babies are younger, they have a different microbiome. And more on that on a different one, because today I want to talk about something else. So factors that you can somewhat control, I won't say everything is under your complete control. Breastfeeding, food, medications, exercise, sleep, stress, disease. Now, medications is something I've highlighted because we are going to talk a little bit more about how medications impact the gut microbiome. And interestingly, how the medications work is also decided to a great extent by the type of gut microbiome you have. So what are the different functions? Devajyoti has already highlighted some of them. One of the primary ones is development and maintenance of the immune system. So this is in the pregnant woman with the baby inside the uterus. And as a former OBGYN, this is like profound for me. So that is for another video. Then the other function is processing nutrients. So how you process fats like lipids and carbohydrates is also decided by your gut microbiome. For example, many of the carbohydrate processing enzymes are present in the gut microbes. You don't have it. We don't have it as humans. So we need their help to digest that. And even more interesting is the fact that how much of the carbohydrate is extracted from food and goes into the fat storage is also to a great extent decided by the type of gut microbes present. Then, Devajyoti, you talked about the xenobiotics. So medications are one of the xenobiotics. Now, why I brought up melamine and dioxin. So melamine is the substance that a lot of the plastic containers and plates and things are made of. And I know in India, a lot of people use melamine. And studies have shown that they do impact not only the gut microbiome, they've also been found in the urine. So melamine is not something that is very harmless. And if you are using melamine, maybe you might consider stopping that because it's cheap and doesn't break. A lot of people use them. Dioxins, parabens, whole lot of xenobiotics are there, which that is one of the big areas of concern nowadays because of the whole bunch of endocrine disrupting chemicals that are present. So again, more xenobiotics. As a person who treats women, I'm very interested in estrogen metabolism in women because the type of gut microbes will decide how much of estrogen goes back into your circulation. So high estrogen is associated with higher risk for breast cancer. So that is again, many people will think, how does my gut decide my, breast cancer risk? So how estrogen is metabolized in the body is also to a great extent decided by the gut microbes. Then vitamin synthesis. Devajyoti, you talked about synthesis of B vitamins and vitamin K. Then the other interesting thing is gut microbes produce a whole lot of neurotransmitters like GABA, dopamine, noradrenaline, acetylcholine, histamine. And we know that on the last video, gut and COVID-19, Devajyoti, you mentioned gut as the second brain. Yeah. Serotonin. So this particular factor that the neurotransmitters are made by the gut bacteria has a huge impact on mood. Now, I I don't want to get into that in detail. So mood issues like, depression or any of the other psychiatric conditions is not just a problem of neurotransmitters. It's a whole lot
Right.
more complex than that. But the important point is the gut and obviously the food you take has a huge impact on your mood. So I'll keep it at that today because we won't have time to discuss everything. But two factors I want to mention is mood is not just a problem of imbalance of neurotransmitters. It's a lot of other things. Inflammation is one of the big ones, but the gut does have a huge impact on that. So antibiotics and disruption of gut bacteria. Before I go on to describe about the study, Devajyoti, what would you say about that?
So yeah, so antibiotics. Well, there are many reports on how antibiotics play a very important role in defining the gut microbiota, both positively and negatively. For example, in many of chemotherapy, uh, let's say courses, people have found that when you give antibiotics along with a particular chemotherapeutic agent, its efficacy increases. Sometimes the opposite happens. It all depends on which kind of microorganisms are prevalent, because some of the microorganisms are linked with increasing efficacy of some of the chemotherapeutic agents. So since we're discussing chemotherapeutic agents here, I must bring to your notice about a very interesting study that happened a year or 2 years back, which was when people had shown that uh, patients responding to PD-1 inhibitors, which are immunocheckpoint inhibitors, uh, they have a different microbiota profile as compared to patients who are non-responders. And then, people have also tried using different probiotics and see if the efficacy of the PD-1 inhibitors, or for that matter, CTLA4 inhibitors, which are again, immunocheckpoint inhibitors, which are the current, very interesting kind of anti-cancer drugs in the market, very promising. And people have used probiotics also to see if their efficacy can be increased. So ipilimumabs and nivolumabs, these are the uh, the inhibitors of the or immunocheckpoint inhibitors that people have seen uh, their efficacy go up with probiotics like B. fragilis and bifidobacteria. So there are many such cases. One very interesting aspect of the antibiotics is that many of these antibiotics are broad spectrum. Uh, so the way they act can differ based on the inherent microflora present in that individual or that organism. So yes, so antibiotics definitely play a very important role. In fact, the kind of microbiota that a person possesses also depends on your antibiotics history. Infants or children who have been exposed to a lot of antibiotics have a very different microbiota profile. And as Dr. Kar was mentioning, people have also shown that that leads to an increased incidence of asthma or allergies. So yes, so antibiotics definitely play a role in shaping the gut microbiota. So better is to avoid antibiotics, but I know there are certain conditions when antibiotics cannot be avoided.
Thank you, Devajyoti. So you brought up a very interesting thing about cancer chemotherapy and gut microbes. So that is more we are looking at the medicine in the next decade or
Right.
further ahead is going to be much more personalized. So obviously, looking at the gut microbiota would also help us in deciding whether this particular drug is going to work in this person. Now,
Yes.
lots of caveats. We don't have all the information yet, and gut microbiota is not the only factor. There are other factors as well. But the fact is, right now, it's like if a particular drug is given to a person, not just for cancer, for other conditions as well,
Yeah.
it's sort of like we just throw it and hope that it's going to work. And there are enough studies to show us that not every drug works in every person. So that is why we are excited about the personalized, individualized medicine, which is the medicine of the future. So the gut microbe is going to decide a big factor in that. But this particular study, why I brought up this one, because ciprofloxacin is a very commonly used drug in India, I know. So this was a very small study, it's from Stanford. So they just looked at the gut microbiome in 3 people, not a big sample size. And they were given ciprofloxacin in the usual dose, 500 milligram orally 2 times daily for 5 days and twice. So within 3 to 4 days of ciprofloxacin, there was a loss in diversity of the gut microbes. And we know that Devojyoti has talked about it before, that having a higher diversity is better. And the other interesting thing is, so they were given 2 doses of Cipro. One was at 2 months and the other one was at 8 months. And the study was for 10 months. Some of the changes in the gut microbes persisted until the end of the 10 months. So they had Cipro 2 months before that. That was the last dose. Now, the study did not look at what happens beyond the 10 months, but we have other studies. I think correct me if I'm wrong, I think there was one which showed up to 2 years later also the gut microbe was different.
Right. I mean, there are many studies.
Yeah, there are many studies. It's very difficult
And,
to look
and,
them.
and some of the studies are actually, they don't correlate, to be
Mhm.
frank. And that is mainly because of, one, the sample size being different. Second, the mode by which they are looking at the microorganisms also vary from lab to lab. Like some people look at 16S rRNA sequencing, some people look at shotgun, and so on and so forth. So there are variations are there, and but one common theme is that antibiotics, logically speaking, also uh, do disrupt the gut microbiota.
Yeah.
So various reports suggest various things in terms of how fast the gut microbiota can redeem itself.
Cover.
So those are there. Yeah, those
Yeah.
studies are there.
So my point is not to say that we don't need antibiotics, but my point is we need to be a little more diligent and not just prescribe antibiotics willy-nilly for everyone. And today we won't have time to talk about, drug resistance and all these different, the super bugs. Maybe that is for another video, Devojyoti. So my point is, number one, everyone doesn't need an antibiotic for every simple thing. Like in India, I know many people carry their own stash of like pharmaceuticals. If they are not a doctor themselves, they'll have some doctor friend or colleague or someone give them. So little, just 2 days, 2 times of loose motion, diarrhea twice a day, no fever, no vomiting, no dehydration, nothing. Or just take some Cipro, just take some norfloxacin and metronidazole. My point is, it's not just the 5 days where they're taking the medications that has an impact. It also has a huge impact long term. So antibiotics, the point is I'm trying to make is we need to respect these drugs because yes, for the right person who does need an antibiotic, it definitely should be given and it's life-saving. But at the same time, we should not use antibiotics for just about, any simple thing. And one more thing, Devojyoti, actually what I wanted to mention is when you mentioned about the different types of testing, and I'm just going back a few slides, is so I know that as a clinician, and I studied in India, we used to do a lot of stool tests, so stool routine examination or stool culture. So stool culture, where we looked at, looking for amoeba and, parasites and things like that, versus a gut microbiome test. So what changed really with the human microbiome project? Because these microbes have been lying around there for millions of years, but we didn't know about them. So what changed that? Number one, what changed in the type of testing? And what was the other thing that had to happen in terms of technology for this to be available?
So in our last episode, I had touched upon this in a very short manner. Good that you brought it up now. Um, see, the microbiology testing of the stool, even now pathologists prefer that because that's the traditional way of testing, is that you need to culture the microorganisms in the lab. And as you all know, not all microorganisms grow in the lab because every microorganism needs a specific growth medium. So, so it was very difficult to actually look at what all microorganisms are present in a particular sample. So that was the biggest drawback or handicap of the technology that the microbiologists were handling then. Things started to change when the concept of next generation sequencing came about. Um, uh, the next generation sequencing basically looks at the DNA or the genetic material rather than culturing the microorganisms. So for example, if you, and that's what we also do, when you take the stool sample, you extract the genetic material out of it, and then you sequence it. When you sequence it, you would know what all microorganisms were present based on the genetic material that we find in the sample. So the advent of next generation sequencing actually changed the way we look at the microorganisms in a particular sample. It can be a soil, it can be skin, and it can be any part of your body where you are looking at microorganisms. So that has changed or revolutionized the way we look at the microorganisms, and whatever associations that we are seeing now is mainly because of this technology. You know, earlier there were anecdotal references of how gut microbiota plays a role in health and diseases, starting from Ayurveda to Hippocrates, who is considered father of modern medicine. Everyone had opined that all diseases begin in the gut, and they were far-sighted, but they did not. I am guessing they did not have the technology then to actually look at that. But now we are looking at that, and every day there are plenty of papers which come out in the scientific literature which suggest an association with a particular microorganism and a particular disease, or how they are affecting xenobiotics and so on and so forth. So I hope I answered that point, Dr. Kair.
Yeah, thank you. So basically what you're saying is this is a very different type of testing, which is not what we are used to as a routine stool test. And a lot of people know this, but I think this information has not gone down to a lot of other people as well. So this is not a stool culture. This is a very different and quite a very technically very advanced testing actually.
Yes.
So it's a very different test. It's not similar to the routine stool test that we used to do, back in many years ago. So going back to the medications impacting the gut microbiome, the next slide, this is, so many of you are thinking, I'm not taking any antibiotics. I have not been on any antibiotics for a long time. So I am safe from any antibiotics anywhere. So this was a study done in Delhi. So what they did is they looked at chicken. So what happens? Why should there be antibiotics in feedlots? The reason is that sometimes these are commercial feedlots. So the feedlots that commercially produce chicken use, they are given antibiotics because it makes them fatter. So if it makes them fatter, obviously the people are going to earn more money because chicken is sold in terms of weight. So what they did is they looked at the chicken from different places. So this was in the NCR region. And 70 samples, up to 40% were found to contain residues of one or more antibiotics. This paper is actually it's open access. I think I got it on ResearchGate. I would highly recommend that if you are interested, you can look into it. This was very, very disturbing. We knew it, but when actually a paper comes out, it's much more disturbing. So 40% of these contained, and these were like ciprofloxacin, ufloxacin, whole bunch of different antibiotics. And I think they tested for about 4, but possibly that there were others as well. So more than 40% of them contained, antibiotics in the chicken. So some in the muscle, some in the organs, different places. And one funny, incident always reminds me. So when I was talking about this, I forget where this wasn't even for women, and this was in Mumbai. So the lady gets up and tells me, "Oh, I'm so happy I don't live in Delhi." I said, "Oh no, this test was done in Delhi. It doesn't mean that chicken in Mumbai is safer."
Right.
So I think a few years later, another paper came out from Mumbai. So my point is, it is there in the feedlots of not just chicken, other animals as well. I think in India, some countries have very strict rules about what can go into the feedlots and what can't. But I'm not sure about the rules in India. So if you think that you're not taking an antibiotic, you've not taken an antibiotic in a long time, you might still be getting it from your food. And again, I don't have simple answers on how you can avoid that, because obviously in countries like Canada, you can choose, I want antibiotic free food and
Yes.
all that. But in India, it's very difficult. My patients will ask me,
Yeah.
"Doctor, what should I do?" I said, I can't give you any simple answers. So
Right.
should you have in Mumbai we call that the gouty chicken, the chicken that is usually it's much scrawny and it's not like a broiler, fat and thick and all that. I don't know about the feedlots that are used for those country chicken as well. Just the thing is, you need to be aware of what goes on. So that is one thing. The next one that I want to talk.
One small point, Dr. Kar,
Yeah.
just for discussion's sake. So even if these antibiotics are present in the chicken, but when you are cooking them in high heat and with all the ingredients, especially the Indian ingredients include a lot of masalas and stuff.
Mm-hmm.
Do you think that the antibiotics will still have their propensity to cause what they can in the intestine, because they should be destroyed, right?
Very interesting question, Devajyoti, and I don't have any data to support or dispute that. But the fact is, antibiotics in the feedlot and some of these antibiotics that are used outside, like even the antibiotics that, let us say, not just antibiotics, other medications as well, that people have not used. So pharmaceutical medications, they are also there in the water body. So they goes into the groundwater. Now the fact is whether I don't think we have studies, and I'll have to ask my nutrition associate whether they compared people who ate these antibiotic laden food versus the other group who ate food that didn't contain antibiotics, and whether they found that there was any difference. So most often nutrition studies are, number one, they are underpowered. So I don't know. That's a very interesting question. But at the same time, I think it was Dr. Martin Blaser who has a lot of research papers, and he has a book called Missing Microbes. So, Devajyoti, again, in the interest of time, I'm going to cut short the conversation because antibiotics in feedlots, antibiotics in places where they shouldn't be, also is, again, associated with a lot of other diseases. Again, association is not always causation. How the mechanistic things happen, I don't know. So if I have any more information about, the question that you brought up, whether people who are eating these stuff versus those who are not eating this stuff, whether there is a difference in them. So, and I don't, are you aware of any studies from India where they've done?
Not sure. No.
Yeah, I don't think.
It's just that heat and all should deactivate these antibiotics. That's my assumption. I'm not.
Yeah. I guess maybe we are not getting the antibiotics, but it could be some other metabolites from from the meat. I don't know. So that's a very interesting question. And next is, okay, this paper came out in 2018 in Nature, and this actually, so we know that antibiotics are actually made to, work against bacteria. So that is something we've known for, and penicillin has, one of the first ones to come up. So we knew that. And we knew that antibiotics would have an impact on the gut bacteria. But this paper was quite a surprise, actually. So non-antibiotic drugs. And for those of you who are interested, this is again a paper that is open access. Very interesting paper. For those of you who understand better than me, you will love it. So what they did is, again, this is not a clinical study. So this is an in vitro study, and they looked at more than 1,000 different drugs. And when they looked at I think they looked at about 38 or 40 different files, I'm not sure. So, but then they looked at a whole lot of them. What they found that all these, and I have just listed a few, like, obviously I couldn't list 1,000 of them here, but the ones I listed here are very commonly used. You brought up metformin the last time. So metformin, proton pump inhibitors like lansoprazole, omeprazole, all those rabiprazole, non-steroidal anti-inflammatory drugs like painkillers, ibuprofen and all these, paracetamol, atypical antipsychotics like clonazepam and aripiprazole. Clomiphene citrate is used in the OBGY world a lot as inducing ovulation. Azathioprine, antidepressant venlafaxine, then mesalazine, then antihypertensive medications. So all these calcium channel blockers, and we talked about the ACE2 receptor on the last video on COVID and gut and COVID-19. So those, then the others like all the different anti-blood pressure medications, estradiol valerate, that is a synthetic form of estrogen, statin medications. So statins are the ones that are given very commonly for reducing cholesterol levels, and statins are supposed to help reduce LDL levels. So that is a different conversation. But my point is, these are drugs that are in common use. And PPIs are something we brought up last time as well. The point is, when we take, and I'm talking about, this from perspective of a clinician, when we recommend any medications, or if someone is taking them, by themselves, some of the NSAIDs are available OTC as well. So what happens is we don't realize all the different implications for this. It's not as simple as, just pop a pill and, your gastritis will go away, or, something like that. It does have consequences. At the same time, I am not saying, or no one is ever going to say that you need to stop all your medications. Obviously, blood pressure medications are something. Then antidepressant medications are also a very big one. Then many studies have come out which show that statin medications don't work the same for everyone. That is a different conversation, where the statins alone will save you. That's not true, because there are 400 different risk factors for cardiovascular disease, and about 25 are modifiable. And LDL is just one of them. So the point I'm making here is, if you, for example, painkillers, like, do you really need a painkiller for every little pain and ache? Because sometimes I think people are not aware of the long-term consequences or even the immediate consequences. And some people are on multiple medications. So we don't know what is going to happen. So one of the biggest one of the most important comments on this article was the surprise about the antidepressants and these atypical antipsychotics and their effect, because we were talking about the gut-brain immune system and how it impacts mood issues. So Devajyoti, your comments on this one?
Yeah, a lot of, actually. So yeah, so there's a science, a new field which is coming up, which is called Pharmacomicrobiomics. It's basically looks at the effect of drugs on the microbiota and the host, and vice versa. So basically, it's a bidirectional thing. Microorganisms get affected by drugs, and drugs get affected by microorganisms. I'll give you a few examples, Dr. Kerr, on this. The famous examples. I mean, there are many actually. Some of the famous examples are basically, one is a drug called irinotecan. I do not know how you spell it. Is it irinotecan or irinotecan?
Yeah.
It's basically a cancer drug, which is it's a first line of drug for, I think, colorectal cancer. Correct me if I'm wrong. I'm not a clinician.
I wouldn't know. I'm not in cancer therapeutics.
Okay. So this drug is generally given as a first line of therapy to colorectal cancer patients. What happens is that when this drug is given, as happens with most of the drugs, it gets metabolized by enzymes in our liver.
Yeah.
And this gets converted. So the prodrug is irinotecan. It gets converted into an active form called SN38. Now that SN38 is the active form of this drug, and once it then it gets deactivated again in the liver, and it becomes it basically gets glucurinated.
Yeah.
Yeah. So then it becomes S38G, and it goes to the intestine. Now, it has been shown that many people or many patients have adverse side effects like diarrhea. Not all, but many. And then when they investigated, they found that there is a microorganism in the intestine which possesses an enzymatic activity called beta glucuronidase, which removes the that group and brings it back to its active form, thus causing inflammation and diarrhea in patients. So if you look at how these drugs affect the individual in terms of their efficacy and toxicity, then gut microbiota does play an important role. Just to add one point, Dr. Kerr, all clinicians, pharmacologists, they know about ADME rules, right? Lipinki's 5 absorption, distribution, metabolism, and excretion, ADME rules, right? The thought right now is to include also the gut microbiota in the whole picture, because then there will be many more such interesting interactions which might play an important role in how the drug affects us. Another very important example, which I was going through in the morning actually, is about digoxin.
Yeah.
Now, digoxin I know is not a preferred drug for heart failure nowadays, but initially it used to be one of the frontline drugs. Now, digoxin basically gets inactivated by the presence of certain bacteria, especially a bacteria called E. lenta. And the most famous of all, Dr. Kerr, is L-DOPA.
Mm-hmm.
Now, L-DOPA,
I didn't bring it up because it was too much. Sorry,
yeah.
Please go ahead.
Yeah. So L-DOPA basically is a drug given for patients who are affected with Parkinson's disease. Now, it has been found that L-DOPA again gets converted into dopamine in the intestine, and M-tyramine, it's again a metabolite, again in the intestine in presence of 2 bacteria. One of them is E. lenta, the other one I'm forgetting right now, and thereby decreases its availability to the patients. So what I'm trying to highlight, as you have highlighted in this slide, is that all these drugs get affected by microbiota, and microbiota also affect these drugs, right? Your antidepressants, for example, acetolopram, which is, I think, serotonin, selective serotonin reuptake inhibitor, acetolopram. It is known to increase the firmicutes to bacteroids ratio. So when it increases that ratio, people have shown that it causes weight gain.
Yeah. And that's one of the side effects of these.
Exactly. So again, goes to show that gut microbiota's role in such medications, basically.
Thank you. So, Devanati, you brought up very important points. Number one, you talked about beta glucuronidase. Beta glucuronidase has a huge impact on estrogen metabolism as well. So, going back to breast cancer risk, that is one. The other thing that you brought up about drug metabolism through the liver. So gut microbes is one factor. The other big factor is again the cytochrome P450 pathway in the liver. So for example, if someone has a SNP, a genetic variation which makes one of those pathways less efficient, and there are some common pathways which impact drug metabolism, and added to that, the person also has gut dysbiosis. So the response in them is going to be very different. But that is just an aside, because you brought up some wonderful concepts. because metabolism are not just of drugs, of hormones, of food, and everything else, and particularly xenobiotics in metabolism in the liver. That has a huge impact on long-term health. And the other interesting thing is, as someone who's interested in nutritional medicine, there are a lot of nutrients which impact the detoxification in the liver. So you mentioned glucuronidation, there is sulfuration and acetylation, whole lot of things. We are not going into that today. The point is, as time goes, I keep saying, as a physician, I cannot even keep up with, this much. That's the reason I'm going to need, machine learning and an AI to help me be a better doctor. So that was one of the things. That very interesting conversation. So again, I'm back to the slide that we started off with, and in the next few videos I'll talk about in the other factors. But the point is, these are things which are extremely important for long-term health, and probably doing a gut microbiome test in every patient is going to become the norm in the future. Mm-hmm. And again, Devajyoti and his company don't pay me to say that. I don't have any financial, ties up with them. But my point is, it is important to know, what else is going on, because rather than prescribing a medication or any kind of treatment which works in some people and not in everybody, why don't we look at more factors which, and particularly in relation to, cardiovascular disease, which is one of the biggest killers in the world, and something like cancer. Like, you'd much rather know ahead of time that this is a drug that's going to work for someone, rather than, you spend a lot of money, and a lot of these medications are not cheap. And not just in cancer therapies, even in my world of autoimmunity, some of those medications are extremely expensive. So rather than finding out later that it's not working, we are, again, lots of caveats. We are not there yet, because we need a lot of basic research. We need a lot of basic research in the world of, particularly, India is so diverse. We need basic research from India. We cannot base everything on, some population which is not from India at all. So thank you very much, Devajyoti. Any last comments you want to add to this?
No, I think we have covered what we set out to. Some of the interesting things that we discussed, about medication and all those things, and you rightly put out, it's research in progress. Nothing is out there in terms of clinical practice, but I'm sure in a year or few years these things will become mainstream. And I think COVID-19 has also, taught us a very important lesson, that we need to spend a lot on healthcare research.
Absolutely.
Research and development is our insurance to life. It's the actual insurance to life. I'm using this platform to highlight this point, because I belong to a private industry, and I know how research and development cost is looked down upon by private industry, and governments also have been pulling themselves out of research and development funding. So I think all these things need to be put in right perspective. And yeah, so hopefully with the advances that are happening, gut microbiota based solutions will be here to stay.
Thank you, Devajyoti. Thank you, everybody. Bye now.
Thank you, Dr. Kai. Bye.